Hello, this is Dr. Grande. Today I'll be covering 6 myths of obsessive compulsive disorder, or OCD. Now, OCD is a mental health disorder characterized by obsessions, intrusive thoughts, and compulsions, which are behaviors that are designed to reduce the obsessions. So let's get right into it with myth number 1. Myth number 1 is that OCD is easy to spot. So as I mentioned, OCD has obsessions and compulsions. And a lot of the times, individuals with OCD realize how unusual the compulsive behaviors look to outside observers. And they may be embarrassed. So they make an effort to hide the compulsive behaviors, counting how many times they turn on and off a light switch, or check a light switch, or turn a doorknob, or how many times they walk into and out of a room, or cleaning behaviors, or any of the different compulsions that we see. So OCD is not always easy to spot because individuals make an effort oftentimes to hide the compulsions. And of course, seeing the compulsions would be really the first obvious sign to an outside observer that OCD is present. The obsessions are thoughts, so they can't be seen, but the compulsions are behaviors most of the time, and of course can be. Myth number 2 is that people with OCD don't realize the obsessions are irrational. Now, with this myth, we really have to understand the specifiers of OCD. And we could think of OCD as having 3 specifiers related to this. There's a specifier where there's good or fair insight, a specifier with poor insight, and another specifier with absent insight or delusional beliefs. Many people fall into the category where they have good or fair insight, so they would realize the obsessions are irrational. Now, some people fall into the category with poor insight, and about 4% of individuals with OCD would fall into the category of absent insight or delusional beliefs. So with those 2 specifiers, poor insight and absent insight and delusional beliefs, an individual likely would not realize that the obsessions are irrational. So with that myth, it's really important to understand the specifiers. So when people have good or fair insight, then yes, that is a myth. People with OCD do realize that the obsessions are irrational. Myth number 3 is that all compulsions are behaviors. So all compulsions are observable. And I mentioned this before, that compulsions are the first sign that people from the outside usually see that lets them know that OCD may be present. But not all compulsions are behaviors. Some compulsions are thoughts. So we have this obsession, the intrusive thought, and then sometimes the compulsion is to think another thought to counter that obsession. So this can all be internal. There's not necessarily an observable behavior with a compulsion. Myth number 4 is that OCD is really just a vigorous desire to be neat. So I think this myth comes from this idea of the contamination, that one of the obsessions we see sometimes is that people are worried about germs, infections, so they clean a lot. And also there's a obsession around symmetry, keeping things lined up, keeping them symmetrical, matching. And yes, this does initially look like an overcommitment to neatness, but that's not what obsessions are. That's not what OCD is. These are intrusive thoughts that something bad will happen. And there are a variety of obsessions, not just keeping things neat, symmetrical, or clean. There's existential obsessions, what we call hit and run obsessions, where somebody's worried about hitting a pedestrian with a car. There's obsessions around violence, where somebody's worried they're going to lose control and hurt somebody. Obsessions around sinfulness, where somebody's worried they're going to commit a sin. We also see, of course, the contamination. We see a person worried about inappropriate behaviors or thoughts, and counting and checking rituals. There's also other types of obsessions, but as you can see, with that diversity of obsessions, it's really impossible to categorize OCD as just an extension of one of those obsessions, like being neat. So OCD is not just a vigorous desire to be neat. Myth number 5 is that OCD is really just a personality type. And again, I think this connects with myth number 4. So OCD is just a personality type, so somebody with that personality type would be neat and orderly. And this is not the case. As I mentioned, we have obsessions here, which are intrusive thoughts, and these compulsions, which reduce that anxiety that's created. this really doesn't have anything to do with the personality type or a desire to be neat and orderly. The neatness and orderliness we sometimes see are driven by obsessions. So this one is really quite similar to myth number 4. Now, myth number 6 is that OCD is the same thing as obsessive compulsive personality disorder. Now, this one I kind of understand. I understand why this myth has become so popular, because these two classifications, these two diagnoses, are easily confused because the names are so similar. And some of the behaviors we see associated with these two disorders is similar as well. With obsessive compulsive personality disorder, we see a preoccupation with rules, details, schedules. We also see perfectionism and inflexibility in the area of morals and values, and being rigid or stubborn. So these characteristics, though, in OCPD, obsessive compulsive personality disorder, don't involve obsessions or compulsions. With OCPD, they really are personality traits. It's a personality disorder. Now with OCD, you might see some of these same behaviors, particularly the perfectionism and the inflexibility in morals and being concerned about rules. A lot of the same symptoms, but they're driven by obsessions. Now comorbidity also contributes to this myth. So we see a lot of comorbidity between OCD and OCPD. About 25% of individuals with OCD would also qualify for a diagnosis of OCPD. So as I mentioned, it is understandable that this myth is so popular, but these are separate mental health disorders. I hope you found this description of 6 myths about OCD to be interesting. Thanks for watching.